Hey guys, welcome to Medifaction. Today we will learn about the anatomy of spinal cord. The spinal cord is a long, fragile, tube-like structure that begins at the end of the brainstem and continues down almost to the bottom of the spine. The spinal cord consists of nerves that carry incoming and outgoing messages between the brain and rest of the body. In this video, we will be learning about an introduction about spinal cord, its features, its meningeal coverings, the enlargements of spinal cord, cauda equina, its external features, internal structure, and some important clinical anatomy. Introduction. The spinal cord is the long, cylindrical lower part of the central nervous system. It occupies upper two-thirds of the vertebral canal and is enclosed in the three meninges. It gives rise to 31 pairs of spinal nerves and retains the basic structural pattern. Features of spinal cord. The spinal cord is 18 inches or 45 cm in an adult male and 42 cm in an adult female. It is surrounded by three meninges. It extends from upper border of the atlas vertebra right here till the lower border of the first lumbar vertebra in an adult. This is the L1. In children, it extends up to L3 vertebra, that is right here, L3. Superiorly, it is continuous with the medulla oblongata. Inferiorly, it terminates as conus medullaris. As the superior cord is much shorter than the length of the vertebral column, the spinal segments do not lie opposite the corresponding vertebra. Meningeal coverings. The spinal cord is surrounded by three meninges. The outermost is the dura mater. Right here is the dura mater. The middle one is arachnoid mater and the innermost is the pia mater. This is the middle arachnoid mater and this is the innermost pia mater. The outer space between dura mater and arachnoid mater is called subdural space. This right here is the subdural space. The arachnoid and pia maters are separated by subarachnoid space which contains cerebrospinal fluid. This is the subarachnoid space. The spinal cord extends in the lower part of first lumbar vertebra as conus medullaris. Below the level of conus medullaris, only pia mater is continued as a thin fibrous cord, the phylum terminal. The spinal cord is enclosed only by the meningeal layer of dura mater. The space between the meningeal layer and the endosteum of the vertebral canal is called epidural space, where epidural anesthesia can be given. The spinal pia mater undergoes modification as follows. A. Ligamentum denticulatum with 21 pairs of teeth-like projection which keep the spinal cord in position. B. Linea splendens, which is a thickening seen at the anteromedian sulcus. The phylum terminal is 20 cm long and after leaving through sacral hiatus ends by getting attached to the periosteum of dorsal surface of first segment of coccyx bone. The dura and arachnoid along with subarachnoid space containing cerebrospinal fluid extend up to second sacral vertebra. Between the lower border of L1 and S2 vertebrae, The subarachnoid space contains spinal nerve roots which constitute the cauda equina. It is due to this feature that lumbar puncture is done below L2 vertebra without any danger to spinal cord. Enlargements. Limbs form the appendages of the trunk. Their muscles have to be supplied by neurons of spinal cord. Neurons at appropriate levels form enlargements to be able to supply increased musculature. Spinal cord presents cervical enlargement for the supply of upper limb muscles. This right here is the cervical enlargement. This extends from C4 to T1 spinal segments with maximum diameter at the level of C6 segment. Another enlargement is the lumbar enlargement for supply of muscles of lower limb. This right here is the lumbar enlargement. It extends from the level of L2 to S3 segment. Its maximum diameter is at the level of S1 segment. This right here is the conus medullaris and here is the phylum terminal. Now let's learn about the cauda equina. Dorsal and ventral nerve roots of the right and left sides of L2 to L5, S1 to S5 and coccygeal 1 nerve lie almost vertically around phylum terminal. These are called cauda equina as this resembles a horse tail in appearance. Dorsal and ventral nerve roots of one segment join together at respective intervertebral foramen to exit as a spinal nerve. This is the location of cauda equina. External features of spinal cord. Anteriorly, the spinal cord reveals a deep anterior median fissure lodging the anterior spinal artery. This right here is the anterior median fissure. The posterior median sulcus is a thin longitudinal groove from which a septum runs in the depth of spinal cord. This right here is the posterior median sulcus. Each half is subdivided into anterior, lateral and posterior regions by anterolateral and posterolateral sulci. Ventral or motor nerve roots emerge from anterolateral sulcus. Dorsal or sensory nerve roots enter spinal cord from posterolateral sulcus. Internal structure. White matter, that is, nerve fiber lie outside and grey matter lies inside. In the center of grey matter is the central canal containing cerebrospinal fluid. The grey matter is in the form of letter H, with a grey commissure joining the grey matter of right and left sides. This is the grey commissure and this right here is the central canal with cerebrospinal fluid. Grey matter comprises one posterior horn and one anterior horn on each side in the entire extent of the cord. Only in T1 to L2 and S2 to S4 segments there is an additional lateral horn for the supply of the viscera. This part is autonomic nervous system. Clinical anatomy. Number 1. Conus medullaris syndrome. Due to injury to S2, S3, S4 segments of spinal cord. Features are A. Anesthesia in the perineum. The region is supplied by these three segments. B. Involvement of bladder and bowel is early. S2, S3, S4 segments carry sacral component of the parasympathetic system which supplies the bladder and lower bowel. C. Sexual functions are affected as same nerves carry out sexual functions as well. Number 2. Cauda equina syndrome. Damage to cauda equina results in A. Lower motor neuron type of paralysis in the lower limbs due to the compression of the ventral nerve roots. B. Root pains is an important symptom due to involvement of dorsal nerve roots. C. Bladder and bowel involvement is late. 3. Poliomyelitis. It is a viral disease which involves anterior horn cells leading to flaccid paralysis of the affected segments. It is a lower motor neuron paralysis, as we can observe this picture. If poliomyelitis affects the upper cervical segments of spinal cord, it may be fatal because of the involvement of C4 segment which supplies the diaphragm. Number 4. Tabes dorsalis. It occurs during tertiary stage of syphilis. There is degenerative lesion of dorsal nerve roots and of posterior white column. This right here is the posterior white column. Its feature is severe pain in lower limbs as the disease occurs in lower thoracic and lumbosacral segments. The lower limbs are mainly affected. Hope you have understood the video. Like, subscribe and press the bell button for more videos. Thank you. Thanks for watching.